Hey everybody, this is Michael Kazmerski, and for my topic presentation, I will be doing an economic analysis of the Lower Drug Costs Act now. So the Lower Drug Costs Now Act, what is it? Definition: the Lower Drug Costs Now Act is a proposed U.S. law aimed at reducing prescription drug prices, particularly for seniors and people on Medicare. So given that definition, what would the purpose be? The overall purpose would be to allow Medicare to negotiate the price of certain prescription drugs. There's not too much movement wiggle room there. There seems to be a hold on it from things like Big Pharma and other companies like that. To implement price transparency for drug manufacturers, so you know exactly what you're paying. There's no hidden fees or costs like that. And to provide a cap on out-of-pocket drug costs on Medicare beneficiaries. Given how everything is so expensive nowadays, it's crazy how much things cost, especially when it comes to prescription drugs, medicine, things like that. So this is taking an aim to give a little more wiggle room and provide a way to be able to negotiate a price instead of just leaving it all up to the manufacturers. So the impact. What's the main impact here? So we have the seniors, as we mentioned, to have reduced costs for medications and improving access. Senior citizens are a large portion of the population that are paying for things of that nature. Medicare also, as we stated, potential savings and more affordable coverage for millions. Clearly, there's a lot of people on Medicare. And for the pharmaceutical industry, facing opposition due to concerns about innovation and profits. Like I said, they control most of the, if not all, of the pricing power. They get a large portion of the profits, and it seems like things keep getting more and more expensive without any way to be able to afford it or any chance of it, the price going down anytime soon. So this is an aim at helping to tackle that issue. So for the overview, historical context. So you have things like the Medicare prescription drug benefit in 2003. This is the creation of Medicare Part D, which allowed seniors to receive prescription drug coverage, but drug prices continue to rise. Like I said earlier, it's still continuing to rise at a crazy rate. You have the Affordable Care Act in 2010, which was huge, included provisions to lower prescription drug costs for seniors and close the quote-unquote donut hole in Medicare Part D. But it did not allow direct price negotiations. So we're still seeing they're still trying to keep a hold on them being able to have a grasp on prices and things like that. So if you look at the global comparison, what's going on in other countries? Other countries like Canada and the UK already negotiate drug prices, resulting in lower costs for consumers. So they kind of got the right idea. I'm sure they have some of their own problems, but still, at least they're making an effort to try to keep it in check. So previous efforts. What do we have? Proposed bills, 2019 and 2020, not that far away. These are efforts to allow Medicare to negotiate prices, have been introduced but failed to pass. It's tough when you have big companies that have a stranglehold on it. They don't want to let it go. And then public outcry. Obviously, the population, they've known for a while. It has become a very growing concern over high prescription drug prices. And it's led to widespread support for reform. People need their medicine and they can't get it. They're having a hard time paying for what they need to get through their day-to-day acts. So the goals, what do we have? To allow Medicare to negotiate drug prices. For the first time, Medicare would directly negotiate with drug manufacturers to reduce costs. That would be a humongous goal. As we just stated earlier, they've tried and failed. So that would be a huge one. Clearly lowering the overall cost for what it is people need to survive. Lower prescription drug prices. Again, huge. Reduce out-of-pocket spending for consumers, especially seniors, make up a large majority of the population, for something like that by lowering the overall cost of medications. We said before, increase price transparency. So what exactly does that mean? Drug manufacturers would be required to disclose price increases and provide justifications. Why are they making it so high? Why are they increasing the price of a drug? For what reason? Instead of just doing it just to make more money. The out-of-pocket cap. Implement a cap on annual out-of-pocket expenses for seniors, ensuring financial protection. Pretty straightforward. And expand access to affordable drugs by importing drugs from other countries and making high-cost medications more affordable for Americans. Again, straightforward. Is it too high here? Can we import from somewhere else? Is there anything we could do to help cut costs, to help the people be able to afford it and get what they need? Policy details. So what would the policy details and things like that entail? So you have Medicare price negotiation. Medicare will be allowed to negotiate drug prices for the first time, focusing on the most expensive prescription drugs. So what would they tackle first? Obviously hit the most expensive ones. You know, a lot of the times your most expensive drugs are going to be the ones that people need the most. And if you tackle the ones that people need the most, then they're having a better time affording it. They're not hitting a dent in their insurance or aid that they have, and they can go on to save a large chunk of money. The out-of-pocket cap that we talked about, a cap on out-of-pocket expenses for Medicare beneficiaries, ensuring they do not pay more than a set amount for prescription drugs annually. Again, being taken advantage of, having to pay more than they should. Price transparency, like we talked about, drug companies must disclose price increases and the reasons for price hikes, promoting accountability and transparency. We had mentioned that one earlier. Again, why are they increasing the price of this? What's the reason, instead of just going ahead and doing it? Drug importation, this would enable the importation of lower cost prescription drugs from other countries to reduce prices in the U.S. Again, straightforward, save money. And penalties for non-compliance. Now, this is an interesting one. So, penalties for drug companies that do not comply with negotiated price agreements or transparency requirements. So, let's say the bill gets passed, everything is fine and dandy. We start, ironing some stuff out. It's going to be a rocky road to start. But let's say a drug company, they say, whatever, we make however much millions and millions and millions of dollars. We're not going to comply. We like to whatever. Penalties have to be imposed. If no penalties are imposed, then no one's going to do it. And and if it's a small penalty, then they'll take the hit, pay it, because they're just going to make the money back. So we have to keep an eye on them, and this is what that act aims to do, is to keep everything in line and make sure people don't continue to be taken advantage of. So what is the cost to social welfare? So the cost to social welfare in this regards, as far as this act goes, you have the increased government spending. So estimated cost, the Congressional Budget Office predicts the cost to be around $500 billion over 10 years, although estimates can vary. That's going to happen. The cost is going to have to come from somewhere. You'll have potential savings on drug prices for sure. The act aims to reduce drug prices, clearly like we stated, which could result in long-term savings for public health programs, including Medicare and Medicaid, which would be great. Savings from lower drug prices might offset initial government outlays by reducing healthcare expenses in the long term. The impact on the private sector, you'll have pharmaceutical companies experiencing revenue reductions. Again, that's going to happen when you're trying to reduce drug price costs and everything. And this could lead to changes in the private sector. It's expected to happen. Research and development concerns. Now, this is a big one because the pharmaceutical companies, big pharma, things like that, they're not getting a lot of money. So what's going to happen as in response? The cost-saving measures could discourage pharmaceutical companies from investing in new treatments, potentially leading to fewer medical innovations. Again, we don't want to see that happen. We want to find that happy middle ground where the people aren't being taken advantage of, but yet you have the big companies, still doing what it is they set out to do, which is to help the majority of the people keep doing research, find new treatments. But at the same time, like I said, we don't want the general public being taken advantage of at the same time. And then the social welfare program's financial burden. So if prices decrease, programs like Medicaid and Medicare may incur fewer costs for pharmaceutical benefits, leading to more funds available for other social services. So as a positive and a negative. Well, so you'll have funds available for other social services, but it might not be allocated to the Medicare, Medicaid, health aspect of that. So again, that would be something that would have to be ironed out and fixed when they're going over that. So let's look at the benefits to social welfare. So, I mean, these ones are pretty straightforward. It's kind of like what we've been saying. Lower prescription drug costs, huge. Medicare and Medicaid savings. Negotiated drug prices can significantly reduce costs for beneficiaries, particularly seniors and low-income individuals. Again, they make up a large population of the people who need these medicines and drugs and things like that. Affordable medications makes essential medications more affordable, improving access for vulnerable populations, like we just said. Improved public health is a big one. Better access to treatment. This is something that a lot of people, you'll see a lot of times they won't get the medicine they need or the prescriptions that they need because they think it's too expensive or it is too expensive. You know, this comes into play with the market power, things like that. If you have companies raising prices and going on like we stated earlier, and they're off to do whatever they want, then the people get discouraged and they go, I can't afford it, so I'm not going to get it. And then the people suffer. So lower drug costs, increase adherence to prescribed medications, leading to better health outcomes for individuals on Medicare and Medicaid. You have a reduction in health inequities, helps reduce disparities by improving access to life-saving treatments for marginalized communities. Again, like we said, you have the people who low-income, poverty, seniors, in debt. They figured that we can't afford it, so we're just not going to get it. You'll have the long-term savings for government programs. By reducing drug spending, the act could free up resources for other critical social welfare programs. And again, there's a lot of programs that could use it. There's a lot of programs that could use the money, that need the money. That healthcare, medical field takes up a lot. This also ties into the inefficient allocation. Allocation sees more positive net gain when deciding what to do with its resources. We went over this in class. Where to focus attention, and what can it do to maximize gain and profit. Inefficient allocation, pumping it all into big pharma. All the money's going to there, increased drug prices, we're spending all our money on this. We don't have money to spend on anywhere else. What would be efficient? Like we stated here, this act could do that. Increased price negotiation, reduced cost, more money for other programs. Potential budget relief for states, allowing more funding to be allocated to education, housing, and other welfare programs. Again, like we said, this ties into the efficiency and efficient allocation. Economic benefits, reduces the financial burden on individuals, especially those with chronic conditions, by lowering out-of-pocket costs. So the people that are going to get it, that have trouble affording it, are paying out of pocket a lot of times. Insurance doesn't cover it. Price is too high. There you go. And helps stimulate economic growth by reducing the healthcare costs that can limit consumer spending. So recommendations. I believe, yes, the policy could improve social welfare. We went over a lot of reasons why. Lower drug costs, significant savings on prescription drugs for Medicare, Medicaid, uninsured individuals, improving health access for vulnerable groups, long-term government savings. Again, we went over it. You have reduced healthcare expenditures, could free up funds for essential social services. Health equity, by making life-saving medications more affordable, it can address disparities in healthcare access, benefiting lower income and marginalized population. Again, we went over that. So how could the proposal be tweaked to improve social welfare further? So we just went over everything, what the act aims to do, how it can do it. It's going to have some tricky areas to work out, but overall is very positive for the people. So what can it do to be improved further or tweaked? So targeted support for innovation. to ensure the policy includes incentives for pharmaceutical companies to continue investing in research and development, preserving access to new treatments. When we talked about it earlier, what was a negative impact? That because pharmaceutical companies weren't going to be getting all this money, they might, quote unquote, take a hit and slow down or stop doing research and development for new treatments overall. We do not want that. This could tie into competition too, with the imperfect perfect. If you provide incentives through maybe the government or something like that, it could bolster companies to compete, to continue to do the drug and research that is expected of them, providing a nice competitive field where they are looking to gain that incentive to offset the reduction in drug prices, to fill the money they might have lost there. So what's another thing? Broaden the scope. Extend drug price negotiation powers to include more drugs and therapies, including those for rare diseases and high-cost specialty drugs. So, instead of just the major drugs, the big ones, the most popular ones, we want to look at everything as a whole. We don't want to be taken advantage of when we are negotiating and passing something like this. We don't want to say, oh, well, we'll allow it, but only for these drugs. No, we want to take a look at everything. And then gradual implementation. Implement the policy over time to allow pharmaceutical companies to adjust, potentially minimizing negative economic effects on the industry while maximizing savings for consumers. It's not going to happen overnight. And if you drop something like that on a program or a system that's been running like this, you're going to run into some big problems. It's this way. If you do it slow and over time, you give people time to adjust. Nothing is ever going to happen fast, especially in the healthcare world, especially in the United States healthcare world. You're going to have barriers to entry as far as the pharmaceutical companies are going to be. You might even have new ones pop up. This could lead to other companies, smaller ones, passing that barrier to entry, taking on the load of maybe making a niche drug or just focusing on a popular one while allowing the bigger companies to focus on the development and research. Again, like we said, you can outsource from other countries. So overall, when it comes to the Lower Drug Costs Now Act, I believe it would be very beneficial and, at the very least, make a dent in the ever-increasing drug prices, medicine prices, healthcare prices overall that people are having trouble to afford. Here are my references that I used for the presentation. And thank you for listening. I appreciate it. Thank you very much.